Hello, my name is Dr. Harshit Mehta. I'm an orthopedic surgeon practicing in Mathura in Mehta Hospital. I have special interest in trauma surgery and joint reconstruction, and I will be speaking on the topic relationship between obesity and musculoskeletal health. The incidence of obesity has almost tripled between 1975 and 2020. Almost one in four individuals in India today are obese, and this leads to various studies have shown that obesity is directly or indirectly related to most of the orthopedic problems, be it knee pain, hip pain, low back pain. Because being overweight puts a lot of strain on the lower half of your body. The incidence of childhood obesity has also increased in the last 10 to 15 years. It makes a deep impact on the health of the children as well. And all the orthopedic problems, be it knee pain, hip pain, low back pain, plantar fasciitis, the incidence is seen majorly in people who are obese. So every pound of body weight, it puts unnecessary. Obese individuals are 20 times more likely to have a knee replacement surgery as compared to the normal individuals. Moreover, the risk of post-op complications like loosening of prostheses, infections, etc., is seen more in obese individuals. Obesity is also responsible for a lot of other comorbid conditions like diabetes, hypertension, cardiovascular health, and cardiovascular diseases and other problems. So people who are obese, they are more likely to suffer from high BP, deranged sugar levels, and other cardiovascular sleep apnea and other psychiatric problems. What to do? So the first thing is you have to see your orthopedician if you want to reduce your weight. So the orthopedician will guide you regarding what kind of activities you can do and what you cannot do. It's very unwise to start doing extreme activities like jumping and running and all those for people who are obese because it puts a lot of strain on your knees. So the orthopedician, he'll assess every individual is different, every body is different. So the orthopedician will tell you what all activities you can do, how to start with light exercises, brisk walking, jogging. Swimming is a very good exercise for people who are overweight because it does not put that kind of strain on your joints. So you light exercises, light weight training. Everybody should go to the gym and lift some amount of weights. That will help you with weight management. Apart from that, regarding you have to see if you are having other associated problems like diabetes, hypertension, you have to see a physician who will tell you how to manage your sugar levels and how to manage your blood pressure levels, etc. So other thing you can do is diet management. That is, you always the baseline, the basic idea behind diet management is you have to be in a state of calorie deficit at all times. You don't have to follow all those fancy diets on the internet. The basic idea being you have to burn more calories as compared to the number of calories you're consuming. So that will help you with weight loss. So you eat a balanced diet, eat a high protein diet, rich in fiber, proteins. You have to cut down on your carbs and fats because the fats, of course, are more calorie dense. So see a dietitian who can make a proper diet chart according to your daily calorie needs and what to eat and what not to eat. And if you want to keep your joint problems at bay, you have to see an orthopedician regular basis. So he'll guide you regarding all the exercises and how to do, and if something needs to be done as regarding your joints. Apart from that, there's childhood obesity. Childhood obesity, you need to control or you need to watch what your children are eating. Your unhealthy diet is leading high a diet rich in carbohydrates and fats, processed foods is you have to make sure you have to keep a check on them, and you have to make sure the children they go out and play in the park or wherever, because inactive lifestyle combined with unhealthy eating is the number one cause for childhood obesity these days, especially in the COVID and post-COVID era where children stopped going to parks and all the play areas, and this led to a spike in childhood obesity. I always ask my patients to reduce weight or see a dietitian or see a weight loss program before they go for an elective surgery. They have to be, because the risk of the prognosis with obese and very obese patients is not as good as normal patients. So it's always better that they know the risks and the results. They can reduce their weight before a knee replacement or a hip replacement. That gives better results, of course. So it's always better that they undergo a weight loss program or bariatric surgery if needed before any knee replacement or a hip replacement surgery. And plus, the weight loss supplements, they don't work. I've hardly seen them work. And more often than not, they lead to a lot of side effects as well. So it's not advisable to go for weight loss supplements. Exercise and diet is the key. So the bottom line is, if you want to avoid orthopedic problems, joint problems, diabetes, hypertension, and if you want to lead a healthy lifestyle, live a long and healthy life, you have to reduce your weight. That can only be done through proper diet and exercise. Thank you.